Back. Next bill is SB240. So I had a request. Yeah, I've got an amendment. Let me go ahead. You guys received an email, and you've got a hard copy of this amendment. So let me tell you what this is about. And we're going to take our time and answer any questions on this. The bill itself addresses the fact that we have a state agency that is fully controlled by a private group. And this is the Board of Public Health. And it's the only example of this in the nation. But we have a private club that names the members of the Board of Health, and then those members, in turn, select the state health officer. And that state health officer has no accountability back to the executive branch or the legislative branch. He's completely free of the reins. His only allegiance is back to this private club, the Medical Association. Well, what the bill, among other things, addresses that issue on a state level. And I got a call from LRS, and the person that helped write this bill up said, well, I forgot to do the same thing at the local level. And we have two counties, Jefferson County and Mobile County, that have their own, Alabama, that have their own public health officer, and they work in sync with the state. So what this amendment does is simply says that the private club, the MASA, does not, will no longer be able to pick the members of that county Board of Health, but it will be picked by the president of the county commission plus several, and it names them several physicians that are residents, that are licensed physicians and residents in that county they live in, as opposed to MASA making that selection and it being the dues-paying members that choose this public officer. It is, in fact, members that are licensee in Alabama. Basically, it opens it up and takes it away from a private group. So the amendment to 240 you got before you, if you look at it, you'll see there are other changes in there. For example, someone from the Board of Nursing is nominated by the Board of Nursing rather than the Nursing Association. The Nursing Association is a dues-paying group. It's a private group. Not all nurses are members of that. But all nurses that are practicing are licensees. So what this would do would say that all nurses that are licensed that live in that county would be eligible for membership, not just members of those people that elect to join the association and pay the dues. So not only would they be able to have a voice in selecting that person, they could be put on that board. And right now, if they're not members of the association, they're not going to be on that board. And this goes exactly the same thing for the dental examiners, Board of Pharmacy. So what it does, it opens it up to all members of that profession that are licensed that have a residency in that particular county. Senator Coleman Madison.
Yes, sir. Go back to where you mentioned Jefferson and Mobile, because we are different, and I didn't see it in the amendment. Does it address it in the bill?
Yeah, Jefferson and Mobile are unique in that they have an active county health officer.
Right.
This does not change that.
Okay.
They still will they'll still be in the same location. They'll have the same people, but it's just the people that will have a voice instead of being restricted to dues paying association members. It'll be all the licensees in that profession that have the residency requirement. Does that make sense?
But we're not,
Senator Roberts?
but we are not excluding Jefferson or Mobile County from serving in these positions, correct?
Oh no, they'll continue. I mean, you probably won't tell a difference, and but yeah, they'll still exist, and nothing's changing. I got some emails where we're canceling it out, and it's not true. We're just changing the way they're selected. That's all. Yes, ma'am.
Can you and I saw some data that someone showed me today. Can you tell me why you feel this bill is important? Because there's in 67 counties, you have county boards of health in all of those counties.
No, ma'am. You only have it in 2
counties.
You only
have it in 2.
Yes, correct. Everywhere else, in all the other counties, it's the State Board of Health is the authority. In St. Clair County, where I'm from, State Board of Health. There is no St. Clair County Board of Health.
Okay. So why do you feel this bill is important to bring? And
Why make the change?
yes, sir. And what do you and how is this going to better improve health or access to health or statistics as far as the citizens? I mean, because all the bills that we pass down here should improve the lives of citizens. So
Amen.
tell me why.
What stimulated this bill, and in fact, I had this bill just about ready before we ever heard the word COVID. It was about ready to go. And in fact, many of our senators I gave out some information a year ago in preparation to get everybody educated about what the issue is. The issue is we have a state agency whose members are named and controlled by a private organization. And that's the big part of what this bill does. It changes that, and it makes the public health officer, the state public health officer, instead of being basically selected by a private group of people, we create a Secretary of Health that's a member of the governor's cabinet.
Like all the rest of the agencies that are accountable.
That's right. And they'll be accountable to the governor. And that person, when the governor selects that person, it comes through the Senate for advising consent of the Senate, just like it does for major appointments. So what happens is the state health officer then becomes accountable to the executive branch and the legislative branch, whereas today that is not the case.
Okay.
It's amazing, isn't it?
It is, especially since this is something that impacts everybody, in particular those people that don't have means to go out and buy private insurance.
Absolutely. And I will say, this is no reflection on the people that are currently doing this job. This is not a reflection on them at all. But what it is doing is trying to bring it in line with the way state agencies are run throughout the nation. This law that deals with these laws were written between 1858 and 1890.
Wow.
And it's been a major operation to bring them up to date and get them current and put where all the tentacles reach is try to cover all the bases and just rearrange. Now, the State Department of Public Health is going to be in the same place, probably have the same folks working there, but at least they're going to be accountable to the governor and ultimately to the legislature, where they're not today. Did that help?
I'm glad you explained it, because I really thought that was another underlying reason for doing this. But now that you've explained this, it makes a whole lot of sense.
Yeah, we had quite a few co-sponsors get on it, and we had a hand. Senator Melton, I believe you're first in line.
You know, I understand where you're coming from. I do. But the state health officer, I don't want him answering to a governor. I want him to answer to the people that are patients in the state. I want him to make decisions that not influenced by his other cabinet members. I'd rather have it by a board of other doctors. I think that, in my opinion, one of the problems now with doctors, and another example, is they answer to insurance companies instead of what patients need. And somewhere along the line, it seems like we keep interfering with the patient-doctor relationship, and like we said last week, we give other people less trained more responsibilities. And now we're going to make somebody who is the state health officer a political position and not a free thinker that's qualified to make the best decisions, to feel comfortable to talk to specialists in a field when it comes to something else. Instead it's going to be which way's the wind blowing from some other people, instead of, hey, I need to go ask these other doctors an opinion. I know we've got a lot of issues in this state with rural health care. We got a lot. You showed me the statistics on hypertension, obesity. I think that's more of a bad personal choices than it is a state health doctor, health director. It's just my opinion. I'll be interested to see how the body votes it up or down. I understand. I just think that, it's not broke. It might be needing tuned up, but I don't think it's broke, and I don't think that I want to see it put in the governor's cabinet.
Senator Stutz.
Thank you, Mr. Chairman.
Senator Stutz, can I ask you a personal question?
You certainly may.
Are you a dues-paying member of Massa?
I am.
Okay. Just curious.
Yeah. And
You didn't ask me. I got to.
yeah. I am a dues-paying member. Are you a dues-paying member of the Optometry Association?
I am, except I actually don't pay any dues. I'm kind of an honorary sort of guy now.
Yeah.
But I am a member, and
Well, here, the first thing I was going to say is I wouldn't describe Massa as a private club. I mean, it's a professional organization that you do pay dues into, and every doctor in the state's not a member of it, granted. But here's my point about it. I think you mentioned how long the current law had been in place, and I think it's worked pretty well since the 1890s. And I'm not in any way opposed to having a review, but a total overhaul is misguided. I'm not saying that the Department of Public Health is perfect, but I don't think it's at the tail end of a pandemic. I don't think is the time to do a total overhaul of the Department of Public Health. And specifically related to Dr. Harris. He and I may not have agreed on everything that he's done, but I certainly respect, number one, his qualifications, his objectivity, and his ability to interact with people at all levels of expertise across the state. And the point that Senator Melson made, I don't want the state health officer to be a political appointment. I want him to be objective and independent of a political appointment to serve at the pleasure of the governor. If he makes a recommendation or a decision that the governor doesn't agree with, they could be removed. And I don't think that is the proper way to do it. I think the proper oversight is a group of physicians, and it was not just physicians on the board that made those decisions. And I noticed, if I read the bill correctly, the veterinarian on the board was left off of the new board. And I think that would be a very important appointment. We've heard more about herd immunity in the last year than most of us probably have in our life, and there's no trained medical profession that knows more about herd immunity than veterinarians, and that would be a valuable person on there. The other thing, I could nitpick the bill apart, but obviously I'm going to be opposed to it. But one other thing that I did notice is that they were only paid $200 a day per diem, and the Cannabis Commission people got $500 a day. and I thought public health was probably up there on par with the Cannabis Commission, but yeah. So anyway, but I think it's the wrong time for a total overhaul. That we need to have an objective review, but not total restructuring of the Department of Public Health. It's just the wrong time for that.
Well, thank you, Senator Stutz, for your comments. Let me. I want to rebut just a little bit, and then Senator Beasley, it'll be your turn. I have no issue with reviewing the $200 a day. That's not a problem. Glad to do it. Leaving the veterinarian off was an oversight, and I appreciate you coming forward with that. You think what?
That's on the county level. That's still not on the state.
Yeah, and I assure you, I'm not targeting anybody. I did put a timer in here. You talked about, and it delays this process for a year simply because of what's going on out there in the public health world now. We don't want to change horses in midstream, but we do. I do want to change horses now. When you talk about the system working pretty well, Senator Melson and I had this discussion yesterday. The system is not working at all. The health outcomes in Alabama are the worst. Probably the worst in the nation, and I'll do a few of these, but I'm not going to bore you. I got a list of about 30 of them. Diabetic population is 49. Infant mortality rate, we're 49th in the nation. Premature death, 48th. Heart disease, 47th. High blood pressure incidence, 49th. Cardiovascular death rate, 48th. I can go down the list. My point in this is we're not in good shape. My point in this is we need some changes in the top, in the policy making, in the leadership group. This is an opportunity to do this. This is the reason I came forward to this. I didn't come forward to this just for fun and something to do. I'm trying to change this state. It just galls me that we have the highest infant death rate in the Black Belt in the country, and nobody seems to care about it. Well, I'm wanting to do some things about this. But in any event, I disagree that what we have currently is working. The only people that have been in a position to do something about this since 1858 have not done anything about it. So I've come forward with something to do something about it and change the policy, and I'm not through. There'll be more. With that being said, but anyway, Dr. Stutz, I assure you I appreciate your comments and respect them very highly. I do, you and Dr. Melson both. Senator Beasley.
Okay. Thank you, Mr. Chairman. Is the appointment, the health officer appointed by the governor, does it have to be a medical doctor?
Does not have to be a medical doctor, but the new Secretary of Health does not have to be a medical doctor, but there will be a chief medical officer that works right at the top with that Secretary of Health.
I kind of think that the state health officer needs to be a medical doctor.
Well, let me tell you, Senator Beasley, why it's worded like it is. The issue, the administrative responsibilities of that chief, of that top person, there's 2,600 employees over there. And that's at a low point. They're at a low point. So they've had almost twice that in the past. That's a heck of a management job. And that's what I see as an administrative kind of job, as opposed to a physician's skills. Now, a physician is part of this thing, a medical director to work with that. But I think...
Who hires that person?
The Secretary of Health. Secretary of Health does. So that's in there. You've got to have a physician up there helping with this thing. But I don't think necessarily he needs to be.
Does the physician have to have experience in the public health arena?
Well, that would be...
Other than just being a medical doctor?
Person's ability, you'd say, okay, well, why won't it work? And they tell you why it won't work, and then you have a decision to make as commander to go back with other courses of action to accomplish the mission. Didn't mean to say it was stupid, but that you absolutely want to listen to a commander, a doctor or a pilot or whoever that's telling you, it's giving you information and feedback.
So in this situation, Scott Harris would have to run it. Whoever the state health officer, would he have to run everything by this appointee, everything by him before he enacts, or does he have free reign? Or
I can't imagine that the Secretary of Health would expect the medical officer of the state to come by and talk to him about whether it needs to order Kleenex or not. I mean, you give people, especially when you pick the person, you give them authority to operate the thing. I think we're nitpicking here.
We're not nitpicking. I'm just saying, what's the function of the person above him?
He's an administrator. He's not a health professional.
Okay.
You're going to have a physician as the health professional.
Well, so the state health officer, does he not have administrators now that do all that in answer to him? Are we just reversing the pyramid here? I mean, that's just what I'm wondering. I mean, surely he's got administrators now that answer to him, and we're just going to put the administrator above. Senator McLean, and I respect you. I'll just say that it sounds like we're changing.
I suspect, Senator Melson, you're opposed to this bill. And
I don't want you to
yet. And Senator Stutz, I suspect the same thing. Do you got one more you want to get in here?
No, thank you. I've got several other points to make, but if it bill gets out of committee, I'll make the points on the floor.
This
In the words of Gerald Dial.
Senator Coleman Madison.
Just one last question. If this were in place right now, looking at the situation that we're in with COVID, what would change? What would be different?
Mr. Chairman.
That's a good question, and I'm not sure I can answer that question. And what I don't want to do is offer a critique of the people that are over in public health right now, working day and night trying to get this problem solved, and I don't want to be a Monday morning quarterback with them. So my hope is of all these health problems we have in Alabama, my whole objective here is to try to make this a healthier state. And
of course, the COVID thing is an extraordinary.
It is that.
It's not just an Alabama problem. This is a worldwide problem. I was just wondering, because I'm assuming, when I see Dr. Harris up speaking, I don't ever assume that Dr. Harris is just speaking based on the information that Dr. Harris himself has. He has a number of people over there that is gathering information, that is responsible for certain duties that he has already consulted with. And when he brings a report to us, which I'm assuming is not going to be any different in that sense than that person bringing back. You know, the key to anything, if you're in leadership position like that, a CEO, is the information that comes to you, source of information, and how credible that information is. So I don't assume that kind of quality assurance would change.
This bill is not about Dr. Harris.
I know.
This bill is about having a state agency that answers to elected officials.
How many other states got the system that we got?
Nobody. We're the only ones that have this set up. Nobody. Senator Gavan.
Thank you, Mr. Chairman. So, am I correct? If the governor wished, she could appoint Dr. Harris to this position. Is that correct?
That's correct.
Okay. And I would just say that I support the concept of the public health officer being a secretary position. There are some issues with the bill on the details and mechanics. I'd like to work with you, but
Senator Gavan, knowing you, that does not surprise me one iota. But I do look forward to you digging into it, and I know you will. Hope we have a chance to work on it and make it as good as we can.
Mr. Chairman.
And where are we?
I've got another.
Senator Studs, do you have something to contribute to this group?
I do. I wanted to just say a couple of things about, you're talking about wanting to improve the health of the whole state, and we all do. But those diseases that you started reading off, if I didn't miss one of them, but the number one risk factor for every one of those diseases that you read off is obesity. And the state health officer is not in charge of diet control for the state. So we've got problems as a state of 48th, 49th, education, a lot of things to pick, but changing the makeup or the process of arriving at a Secretary of Public Health or whatever is not going to change that. The number one risk factor for just about everything on that list is obesity. And we're also one of the most obese states in the nation. And we need to fix that. But what I was going to say is the reason I think somebody for that position should be picked, and I'm not going to embarrass anybody going around the room, but I bet there's not many people sitting at this table that know the educational requirements of an epidemiologist or know what MPH stands for. And what I'm saying is the system we have now, where people that understand those things know the training that Dr. Harris has, know why he's qualified, and to have a political appointment take that position is, to me, is a step in the wrong direction. And so I won't belabor the point because my committee was supposed to meet in this room 10 minutes ago, but we'll move on. But thank you, Mr. Chairman.
Senator Gudger.
Thank you, Mr. Chairman. I have just one question. Obviously, we all have nursing homes that are in our districts. I've got some major ones throughout mine and some of the owners. Looking on page 11, going through page 13 for the State Committee of Public Health, where does nursing homes fit in, and how is that? And if not, can I work with you on the way to the floor if this thing passes to get something in?
I'll tell you what I'd like to do, Senator Gudger, is I'd like to get this amendment adopted on this bill.
Yes, sir.
That makes all those. I started out. We got diverted away from the amendment. So what I'd like to do is adopt this amendment first, and then we'll come to the bill. Senator Gavan makes a motion. I'll second that to adopt this amendment. Pardon? Yeah. Let's do a roll call on the amendment.
Senator McClendon.
Aye.
Senator Beasley.
Aye.
Senator Chasteen. Aye. Senator Coleman Madison. Aye. Senator Gudger.
Aye.
Senator Melson. Aye. Senator Roberts. Aye. Senator Stutz.
Aye.
Senator Watley. Aye. Senator Williams. Aye. Senator Gavan.
The amendment is adopted, and I will answer your question. I'll get with you as soon as we get out of here, and we'll see about that before we get to the floor.
Before we get to the floor.
Yeah.
Thank you.
Do that,
Mr. Chairman.
Senator Beasley.
I'd like to be able to work with you too on selection of the Secretary of Health and the Administrator, because I feel like those roles need to be reversed.
Senator Beasley, your assistance is always welcome.
Thank you, Mr. Chairman.
If there's nothing else, let's do a roll call on the bill as amended.
Senator McClendon.
Aye.
Senator Beasley. Aye. Senator Chasteen. Aye. Senator Coleman Madison. Aye. Senator Gudger.
Aye.
Senator Melson. No. Senator Roberts. No. Senator Stutz.
No.
Senator Watley. Aye. Senator Williams. Aye. Senator Gavan.
Thank you, everybody. This bill's given a favorable report as amended.